forgot to introduce ourselves in the first episode. I'm Guliamna, and my friend is Momin Kazi, and we started this podcast to raise awareness for mental health problems and mental health issues, and to basically reduce the stigma against mental health in our society. So today we'll be talking about anxiety. We're going to talk about what's the difference between anxiety and nervousness. We're going to talk about the symptoms of anxiety so that you are better able to identify it. We're going to talk about the causes, the underlying causes, both environmental and biological. We're also going to cover the experiences, such as we're going to talk about the difference between anxiety attacks and panic attacks. We're also going to cover treatment options and coping mechanisms for those of you who want immediate techniques for in the moment when you're feeling anxiety. And to help us today with this pretty complicated and broad topic is Miss Saima, who is a very highly trained psychologist and specializes in psychotherapy. Yeah, so Dr. Saima is a highly trained and highly qualified mental health professional. She specializes in a variety of mental health challenges, including trauma, anxiety, our topic today, depression, low self-esteem, developing self-awareness, and identity. Her areas of interest include humanistic psychology, the psychodynamic approach, integrated psychology, and addiction counseling. She has actively participated in numerous mental health campaigns throughout schools, including Head Start School when we had our mental health week last year. She had a seminar on anxiety. She also teaches counseling and she facilitates group therapy. It's an honor to have her with us today, and we will be asking her questions along the way. So we wanted to start with Dr. Saima. What is anxiety, basically?
So everyone experiences mild anxiety from time to time. It's actually a great motivator to get us to do things that we generally might feel lazy to do. For example, revising for an exam, preparing for a driving test, taking a job interview. So anxiety actually helps fuel you to prepare for these things. Now, anxiety can be experienced in many different ways by different people. So it can be a sense of uneasiness, it could be a sense of nervousness, a sense of fear, maybe a sense of dread of what may happen, what's to come. So, but the difference is when these thoughts and feelings become to a point where they become more frequent, they become more intense, and maybe they start becoming overwhelming to the point where you can't sleep. That's where there might be a cause. It might be a case of an anxiety disorder.
Ma'am, could you talk to us about what the underlying factors that affect anxiety are?
Okay. Well, see, there's various forms of anxiety disorders. There's so many, but the symptoms are actually different for each disorder. So if I was to share, let's say, the most common anxiety disorders, we're looking at things like generalized anxiety disorder, or GAD, obsessive compulsive disorder, or OCD. Then there's social anxiety disorder, also termed social phobia. Then there's PTSD, post-traumatic stress disorder. So one of the most common disorders is GAD, or generalized anxiety disorder. In this one, the person sort of excessively begins to worry. They worry about school, they could be worrying about work, they could be worrying about their health, the health of family members, and also an overwhelming worry for the future. And they always generally lean towards the worst case scenario. So it could be a very small thing, but for them, it's always like it's really amplified. So the symptoms of GAD are things like excessive worrying. They may have as I mentioned, they may have an unrealistic view of what the situation actually is. For example, a family member might just have a flu, but for them it's like, oh my God, it could be pneumonia, which I know right now is really sensitive because with the COVID pandemic, we have to be careful. So I don't want anyone thinking, oh, it's just a flu. It's okay. I don't need to get it checked. No, please do check out. Please do keep an eye on the symptoms for COVID because I know it's really, it's something that is of great concern at the moment. And another reason why so many people are anxious at the moment. I thought, okay, practicing from home, I'm not going to have as many clients because I've never really done online sessions before. It was always one-to-one.
Yeah.
But I don't have space for clients anymore because there's that many that have now started coming for therapy because they're so anxious.
Yeah.
So the causes of generalized anxiety disorder, they're actually unknown. But some of the factors that can cause it are things like genetics, brain chemistry, and environmental factors such as the death of a loved one, abuse, changing schools, or changing a job.
Ma'am, could you talk to us about what the role social media plays in regards to someone who has anxiety? So, what does someone who has anxiety go through when they open Instagram?
Social media for me, if it was up to me, I would ban all social media. As much as it has so many benefits. Of course it does, but unfortunately, it also has drastic effects on a person's mood as well. Especially amongst younger adults and children as well, social media is the highest contributing factor to anxiety.
And how does it do that though? Does it contribute to body dysmorphia? Like using filters on social media like Snapchat, does that affect our self-image?
Oh, absolutely. It's definitely the things that you've mentioned. The fact that people feel that they do need to edit their pictures before putting them online. The biggest issue that I know my clients have had are, how many likes am I going to get? Is anyone even going to look at my picture? And when they do, what will they say?
Ma'am, could you talk to us about what the positives of social media are? So, I would assume someone with social anxiety would benefit from starting off with online friends as opposed to starting off with friends in real life.
Again, that's a really good idea, especially times like this where we have to practice social distancing. And I think it's great that we can keep in touch with our family members and our friends. So yes, absolutely a huge benefit. But that too comes with its disadvantages because the level of online bullying right now is atrocious.
Yeah.
The amount of, especially younger kids and younger adults, the amount of people that are experiencing bullying online it's skyrocketing at the moment. It really is.
And on that note, what would you suggest for someone who has anxiety and goes through bullying? Like after they've experienced bullying, they're really anxious around certain people, or they're just anxious around people in general because of that one experience. So, what treatment options or coping mechanisms would you recommend for them?
Well, if possible, it's great to sort of distance yourself from those people. If we're looking at the best ways, I mean, the things that we recommend to our clients are to stop replying. Stop replying to those people who are aggravating the anxiety or the stress that they're feeling. Definitely gain help. Do reach out to people so you feel that support.
Ma'am, could you explain the difference between anxiety and phobias? So, what does it look like when someone has anxiety as opposed to someone being afraid of closed spaces, or someone being afraid of heights, or someone having a social phobia as opposed to being socially anxious?
Right. So phobias actually are a form of anxiety. So it's just irrational and it's an unrational and unreasonable sense of fear.
Okay.
So, like you mentioned with vertigo, with you mentioned claustrophobia, there's arachnophobia. I actually suffer from musophobia, which is a fear of rodents.
Oh. Okay.
So if you see me run, it's not you guys, it's because I probably saw a mouse. So I would just run. And I actually get all the symptoms of musophobia as well. So I'll have an increased my heart rate, just like I'll have a palpitation attack. I'll start sweating.
Yeah.
And then I'll start having nightmares, actually about a mouse or a rat. So it's actually quite an extreme, quite a debilitating sort of anxiety.
And how do you cope with the symptoms? Like when in the moment, how do you cope with the symptoms? If like you're sweating and your heart rate is beating faster, how do you get yourself to sort of get back into a calm state?
Right. So as I mentioned with GAD, with general anxiety disorder, the mind starts to race. So for me, what I experience is I'll start experiencing all these scenarios in my mind.
All right.
And like, my husband or my son with me will say, hey, look, it's just a mouse.
Yeah.
But for me, it's the scenario is so amplified that I see it actually attacking me, which I know for most people is like, it's a mouse.
Yeah.
But so what I do in times like that, I'll check in with myself, like what's happening for me. So I'll regulate my heartbeat, I'll regulate my breathing. So I'll just, practice a little grounding technique at that point. So by grounding, I mean I'll practice breathing, I'll count backwards from 5. So then that helps me to ground myself. And I can then start looking at the situation in a more realistic sense.
All right.
I was talking to a few of my peers, and they said when they experience anxiety, what they try to do is they try to overwhelm their senses. So one of my friends said that whenever she's having an anxiety attack, she like bites into a lemon, so her brain starts focusing on something else. Is that a healthy coping mechanism when you're going through a panic disorder? Because in my mind, that sounds like the logic people who self-harm use. They say we self-harm ourselves so that we can think about something else.
Yeah, absolutely. Distraction is a great coping mechanism at that particular time. So, like you mentioned, biting into a lemon. People who have suicidal ideations or tendencies, we generally recommend, again, something to do with the senses. So putting an ice cube in the palm of their hands so they can feel that cold sensation, it really helps to distract at that time.
Wouldn't you need to do bigger and bigger things to feel the same effect though? So wouldn't, if someone's trying to flood their sensory organs, wouldn't they say, I need to keep increasing the sense to start feeling something anymore?
That's why it's great to adopt a few different coping mechanisms. So, for example, someone who is feeling immensely anxious, we recommend many different things to them. It's a form of sublimation. So with sublimation, you distract or displace the energy that you're feeling towards yourself or for harming. You then displace it onto something else. So, for example, working out, you may decide to punch a boxing bag thing, a punching bag. Sorry. Yeah. So you may decide to start doing that because that then will distract once again your attention to something else. So yes, I agree. It depends on the intensity of the anxious feelings.
Yes, of course. And could you talk about resources in Pakistan for people with anxiety, like especially individuals with debilitating anxiety that interferes with their everyday life, where they could seek treatment or where they could seek therapy?
Therapy Works it's an organization is located in Islamabad, Lahore, and Karachi. So it's it's also it's a place where they offer counselling, and it's also a rehabilitation centre as well. So they offer therapists with a wide range of expertise. And they also have a sliding fee scale as well, which is really helpful because then it provides therapy to everyone and anyone because it's affordable. So it makes it more accessible as well. Oh, so I was going to say in Islamabad there's a psychological or a psychiatric department in most of the hospitals here. So that's a place that they could go. And as you mentioned, during the pandemic, what is something that they can where can they go? What services can they avail? Well, Rosen actually have started this. They offer counselling via the telephone.
Sorry, I didn't quite catch the name.
Rosen.
Okay, Rosen.
Okay.
So they're actually offering counselling via the telephone. So that's something that people can avail as well.
Yeah.
During this time, especially.
Something that I would say as an experience of a student, where do you think it's important where you're talking to a school psychotherapist, and where do you think you step in where you're like you have to go to a professional separately on the side as well who can give you separate treatments? Do you think there's a difference there? Do you think there's a point where a student needs to go for extra help as well? Or do you think that going to a school psychotherapist is enough?
From what I've experienced in Pakistan, it's generally career counsellors who are available in school or counsellors. So they are people that they can definitely help initially.
Yeah.
But I feel that there's times where, like you said, Qazi, I think there are certain limitations for sure.
Yeah.
Right. Absolutely.
Because in a session with someone outside of school, they'll be able to give you sufficient time for you to be able to process. Where in school you might not be able to get the same amount of time. There's also this fear with some students maybe that, am I going to be safe?
Yeah.
Will people
Right.
find out?
Yeah.
So it's definitely a great resource, and I would definitely recommend students who are feeling stressed or anxious to reach out for sure.
Yeah.
And if the school counsellor feels that okay, you know what, I think it's a great idea for this student to reach out and see a psychotherapist outside. Maybe it's something that they can discuss amongst themselves and then seek advice somewhere else as well.
Ma'am, how can a student or a minor talk to their parents about having anxiety? So, what kind of conversations can they have with their parents where they're trying to explain to them that their anxiety is serious and they need to go to a mental health professional to be able to address it?
In cases like that, I mean, it's such an important question that you've brought up here. I think it's sad where children maybe don't have that space at home.
Mm-hmm.
Yeah.
Because it's crucial. It's crucial for everyone to seek help, whether that's professional or being able to reach out to family members and friends. But I would say, just be honest, be genuine.
Right.
And express exactly what it is that you're feeling.
Mm-hmm.
I think at times our communication with our parents can become quite passive.
Right.
So we don't really express what it is that we're feeling because we're worried. We're worried for them that, oh my God, no, maybe my mum or dad might get worried for me if I say that I'm feeling really anxious or maybe even depressed.
Mm.
So they generally worry about what the parents think. But I can guarantee you most parents actually want their children to come to them and say, hey, you know what, I'm feeling really anxious right now and I need help.
Right.
But even when you have that conversation, there are some times when, even though the parent cares and does want the child to come and ask them for help, they still won't accept that anxiety needs treatment, or something like anxiety or depression requires extra professional help. They'll think, okay, you should have come to me with this problem before, and I can help you. You don't need to go to a therapist. You don't need any kind of extra help. So how do you make them, what points can you make basically that could help them understand that it is something real and it is something you actually need help for, just like if you would say I have the flu and I need to go to the doctor.
Yeah, now that one definitely that's a difficult one, because there are students who have come to me that I can't speak to my parents, because whenever I do, they always ask me to come and talk to them instead.
Yeah.
Which is great, and I absolutely do suggest that people do reach out to their parents. But as for counselling, it's definitely a difficult. It's a thin line, because how can your parents counsel you? Because their own overwhelming feelings will then intervene as well.
Yeah.
Because they're your caregivers.
Yeah.
They want to be able to help you in every way they can. But
I can
when it
speak from
comes
my
to
own
counseling,
experience where even if you do bring it up with your parents, or they would suggest going to a psychiatrist and going for medical therapy. Where in that point would you say that? What would you suggest we say that should a person go to a psychiatrist or a psychologist?
In my opinion, if it's, let's say, someone's feeling really overwhelmed by exam pressure, maybe all they need is just to talk.
Yeah.
So going to a psychologist and being diagnosed, or going to a psychiatrist and receiving antidepressants, isn't really what the need is at that particular point. Maybe all they need is just a counselor or a psychotherapist who they talk to, and they may be able to give them coping mechanisms, and also offer therapies, things like such as CBT, which is cognitive behavior therapy, which again it gives you coping mechanisms such as stress management, grounding techniques, guided meditations, and there's so many other techniques that CBT has that can help you manage the anxiety at that time.
Yeah.
Right.
So you don't really need medication.
Right. I have a two-part question here. First part is, how can we, as the friend of someone or a cousin or whatever, what advice can we give to someone if they're saying, I'm having an anxiety attack, or someone right next to us is having an anxiety attack? What can we say to them to make them feel better? What's the appropriate thing to say there?
So I think at that particular time, your presence is really important for them to feel that they are safe. So giving them reassurance that right now they're safe, you're beside them. So maybe giving them a glass of water and helping them to calm the anxiety at that particular time. Maybe giving them a grounding technique. Ask them to focus on an example of a grounding technique is using the 5 senses.
Right.
So, like, you could suggest to them, hey, look, can you share with me 5 things you can see? And then at that time, they may say a bottle of water, they may say a laptop, a mug, so they'll share 5 different things. And then it's 4 things that you can hear, 3 things that you can touch, 2 things that you can smell, and 1 thing that you can taste.
Right.
Yeah.
It just basically helps them, it brings them back into the present moment. Because at that particular time, their mind is like racing into what may happen.
Yeah.
Right.
So they're not even with you at that particular time. Their mind is racing forward.
Yeah, and at one point, do you, as a friend, tell your friend to seek professional help or to seek help other than your own? Because of course you care about them and you want to help them through their anxiety as much as you can, but you're not a licensed therapist, you don't have experience. So at what point do you say, okay, I think you need to see someone else as well, you need to see some professional help on the side?
Absolutely. Your own self-care is incredibly important as well. So there's so much, you're so right, there's so much that you can actually help someone else without being affected yourself as well. So I would say at the point where you feel, I can't do this anymore, because now it started having an effect on me.
Right.
So that's where I would say, you know what, I'm here to support you, but I do feel that you need help from someone else as well.
Ma'am, could you talk to us about the role that friends need to play in helping in supporting someone who's going through therapy? So, as a friend, do I have to step in? Is it important for me to talk to the psychotherapist? Where does a friend step in? Is it my responsibility as a friend to check in if my friend has done the homework that a psychologist has given him?
I'd leave it between your friend and the professional. But
Right.
if you do feel maybe initially when you do recommend them, because if it's you that has to communicate between the therapist
Right.
initially to make that appointment, if it's you that
Right.
has to take the first step, then yeah, absolutely, maybe share with them that my friend has been experiencing these symptoms over the last month or so,
Right.
maybe a year.
Yeah.
So I wanted her or him to get some help. And so, yeah, absolutely, I would share there, and just to be that support system. So,
Right.
if, for example, the therapist is giving your friend homework, maybe just checking in with them and saying, hey, you know, how's it going?
Right.
And if they share with you that, oh, I've been given some homework, maybe just checking in and saying, have you done it?
Yeah. So on the note of helping your friend, when one of my peers says that it helps to get all of the anxious thoughts out for them. So when they're experiencing anxiety, they like to let it all out and say everything that they're going to say everything that they're thinking in their head. So is it helpful to let them say all of that and think all of that, or are we supposed to interrupt the thoughts? What are you supposed to do in that scenario?
Oh, that's a good question. Because if they're feeling anxious at that particular time, it's the anxiety takes over.
Yeah, but
They
it's like
just
they have like
wanna.
the running thoughts and they need to let it out. So they'll like say this is what I think is gonna happen, and they'll just go like on a train of this is what I think is gonna happen, and you can see that the symptoms are getting worse because they're vocalizing everything that's going on in their head. So do you interrupt them with a grounding technique? Do you tell them to stop and take a breath, or do you let them get all of that out so it can get off their chest? Like, what's more helpful for them in that situation?
Say, check in with how often they do this.
Okay.
If you find that they go on this excessive rant all the time,
Yeah.
again, you've got to take care of yourself as well by always having to listen to a friend, I guess, pour out their anxiety onto you. You're going to start getting tired by that as well, because it does have an effect.
Yeah.
You may stop meeting this friend. You may start to avoid them. So absolutely, I feel if it's something that goes on a regular basis, definitely intervene. Definitely intervene. And I would say the best thing for someone who does that is maybe ask them to journal.
Okay.
For people that have so much anxiety inside them, a great coping mechanism can be journaling, where they can just pour all this, all these thoughts and feelings onto a piece of paper.
Yeah.
Right.
Yeah.
Can we talk a little bit about what someone is doing if they're having withdrawal symptoms? Because I think that would be similar to what you're going through in anxiety. You're anxious about any kind of withdrawal symptom from a drug, from drinking. What does a person do there? I had a conversation with someone and they were saying smelling peppercorns. That's apparently something that's very popular these days, where you smell peppercorns if you're having withdrawal symptoms. Is there any truth to that?
I actually haven't experienced that as yet. But hey, if it works, then why not? Peppercorns it is. But for someone who's having withdrawal symptoms, that's a really difficult one. That can be such a dark place, such a difficult situation for them to deal with. And at that particular time, they need support. And of course, because they are going to be on certain medication as well to aid with the withdrawals. It's just a matter of just offering support, really. at that particular time.
Are there any resources in Pakistan for people who are specifically recovering from alcohol and drug abuse, like AA meetings?
I'm not aware of any particular sort of AA, an association that offers that as yet. But I have heard that there's something in Lahore.
Right.
And they have, I think it's NA meetings, so Narcotics Anonymous.
Right.
But that's something which we are definitely thinking about at Therapy Works. Just to share that I actually practice and teach at Therapy Works as well as private practice as well. So AA and NA meetings are something that we do want to start soon, because it's great that we offer like 3-4 months programs at Therapy Works for rehabilitation. But then what happens after that?
Right.
Yeah.
Right. So I feel that they do need the support afterwards as well.
Right. Absolutely. Coming on to another topic, can we talk a little bit about test anxiety? So I know people who personally, while sitting in the examination room, some people are so anxious that they literally faint. What can they do to feel better? What do they do in the examination room? Because obviously in an examination room, there's a certain code of conduct that the examiner will force on you as well. You have to act in certain guidelines. What can they do in those circumstances to feel better and not to literally pass out or something?
I would say starting the preparation for like preparing themselves before the exam. So the anxiety that they walk in with, they need to try and manage that before they sit at the table. So practicing grounding techniques, checking in with themselves, checking in with their heartbeat. Like we tell clients who suffer from panic attacks don't just, we have to understand that there's signs for panic attacks, and we get them before. We get them at times days before, because it's just, there's a need to check in with ourselves. And I guess that's where we sort of tell everyone that please try to practice more mindfulness in your lives, because it's when you check in with yourselves, you know what's happening with your breathing, you know what's going on with your heart rate, paying close attention to your breath.
Right.
The breath that you take in and the breath that you take out. Noticing, is it shallow? Is it deep? Is it staggered? Or is it smooth? Just checking in with the breath. That can really help. And then positive affirmations, telling yourself that this is going to be okay. This is, again, grounding. Bringing wherever that your mind is, which at that time it could be at a very amplified state. Because you're going to start thinking of so many unrealistic scenarios, like, oh my God, I'm going to fail. I can't do this. So rather than saying that I can't do this or this is going to happen, just telling yourself that at this moment, I'm okay.
Right.
And this, after 2 hours, I'm going to be done. And everything's going to be okay.
What are
Can you talk to us a little bit about what a panic attack looks like? Like, what in the moment is a panic attack? What is someone feeling while they're going through a panic attack?
So a panic attack comes on suddenly. It can come on all of a sudden, and it involves intense and often overwhelming fears. So the symptoms include a racing heartbeat, shortness of breath. Some people feel really sick as well, so that they may feel that they want to vomit. So that's what a panic attack can look like. There's two types. There's unexpected and there's expected. So the unexpected comes on for no obvious reason. It just suddenly comes on. With an expected one, they're brought on by external stresses. Like, for example, an exam, certain phobias. So they can cause panic attacks as well. So yeah, there's those two types.
Right.
What's the difference between a panic attack and an anxiety attack? Because I think those two words are used interchangeably, but they are separate.
Yes, absolutely. They're definitely the same as you mentioned, but the conditions are different.
Okay.
Between an anxiety attack and a panic attack. So, as I mentioned, panic attacks come on suddenly and they can be incredibly intense and overwhelming.
Yeah.
With an anxiety attack, it isn't as intense.
Okay.
So, it's more, I guess, a sense of frustration, uneasiness, a sense of worrying. And it generally comes on gradually,
Like
whereas a panic attack is sudden.
I didn't understand one thing though. When you're talking about symptoms, so a lot of people don't understand that it's anxiety that they're experiencing. So how would they be able to identify that? How would you know that I'm anxious for a test right now? And how would you know I have anxiety? Like if you, like I know how there's like the symptoms are that if you have the symptoms of anxiety for a stretched period of time, like for maybe 2 months you're anxious, but you could come up with the excuses like maybe it was because I had a bunch of tests or I had a lot of homework. So how would you be able to differentiate between having an anxiety disorder and just being anxious? And is it really that important to differentiate when the coping mechanisms and stuff is almost the same?
Okay, so I think with something like if you're stressed, you may generally feel frustrated or nervous about daily tasks. Like, let's say if you've got to multitask, you've got an exam to prepare for, and at the same time, you've got an essay to also hand in as well. You maybe have family errands to run.
Yeah.
That's definitely going to bring on symptoms of stress.
Yeah.
With anxiety, though, it's more a feeling of fear, uneasiness. You excessively worry. And it can generally be a reaction to stress.
Okay.
Right. And then can we talk a little bit about when a person has identified that what they're going through is anxiety, how they can identify if it's serious or not. Like, let's say that they experience anxiety. Let's say they experience anxiety for a certain amount of time, then they stop experiencing it. In their mind, should they say, "I don't need to go through anything anymore because I'm not feeling that anxious anymore"?
Absolutely. Like, for example, with a panic attack, let's say if it happens like once, then you're okay. But if, for example, you notice that you've had that panic attack more than once, then that could be a panic disorder.
Right.
So yes, absolutely. How many times it occurs plays a big part to whether it's a disorder or whether it's just anxiety, whether it's you're just feeling a panic coming on.
Right.
And again, yeah, definitely like check in with the symptoms. With stress and anxiety both. Physical symptoms can be stomach aches, muscle tension, headaches, sweating, dizziness. You might feel fatigued. Emotional symptoms can be panic or nervousness in social settings. Irrational anger as well. You might start feeling that, I don't know why I'm angry, but I'm really, really angry right now.
Right.
A sense of restlessness, and also feeling anxious about what may happen.
Right before we end, can you give one small message where you talk about people who are going through something, anxiety, depression, whatever they're going through? Can you give a message of hope to those people?
So I would say, guys, just check in with yourself, see what's going on with yourselves. If you find that you can't reach out to a therapist, or let's say you can't get out and actually sort of visit one, which at the moment no one can, hardly. I would say definitely reach out to family members and friends. Do please avail services like Rosen, who are offering counseling via telephone. Again, like I said, you can reach out to Therapy Works. We have a sliding fee scale. So if it's a student who might not be able to give the payment, the allotted fee, then they're more than welcome to come in for free sessions. There are therapists who are actually offering these services at Therapy Works. And for sure, please, guys, practice whatever makes you feel calm, whether that's coloring in, whether that's doing a jigsaw puzzle, whether that's practicing yoga, practicing meditation. One thing I would highly recommend, guys, it's for me, one of the best meditation apps out there, Headspace. It's amazing. It offers free guided meditations for beginners from 3 to 10 minutes. So depending on how much you practice. I'm still on the 3 minute one because I find it hard to sit still for a long time. But and there's many grounding techniques on there, and it's so cute because there's lots of little cartoons and stuff that keep you. I like, as you can see, I prefer things to be visual rather than having to read long paragraphs.
Yeah.
So really easy to follow as well. So guys, please reach out. You're not alone. There are so many people out there to help. It's just a matter of you just reaching out. So please do.
Well, thank you so much for
Thank you,
taking
ma'am.
part, ma'am. We are
Thank
so
you.
grateful that you accepted our request to be on the podcast.
Yeah.
Your advice is absolutely crucial. I know how many people in my life, at least, are suffering from these kind of things. And I would suggest that everyone listen to ma'am carefully, listen to what she's saying, and then try to go for psychological help if that is something that you can avail. Again, ma'am, thank you so much for accepting our request to
Thank
be
you,
here.
ma'am.
And thank you guys for listening. And then we'll tune in next week.